Hello. So today I'm going to show you again my faceless demonstration material. The initial supplies that you will have to be on your table. Every wet activity will require a table barrier. In this case, this is your table barrier. So you will have two big towels and three of the washcloth. Has to be colored. Could be green, could be blue, could be brown. So why is it colored? Because this goes down to the perineal area. So the one that you will use for the face of your resident will not be the same face towel or the washcloth that you will use for the face. Okay, my supplies. I have two big towels, three washcloths, one disposable bed protector, also a pair of gloves, and then you have your soap and your basin. Okay. Then the usual way you have to prepare that and alert your proctors. Okay, I'm ready. Already washed my hands. Knock, knock, knock. Good morning, Miss Mary. My name is Ricky. I am your CNA for today, and I'm here to assist you with the catheter care. May I come in? She says yes. All right. Hi, Miss Mary. I'm here for your catheter care. Miss, first check your wristband. That's you. I'll go ahead and close the curtains for privacy. Then I'll make sure the windows are locked, and then the bed is closed position with the cold lights next to you, cold light buttons, and I'll be right back, Miss Mary. So when you're back, immediately you will raise the bed to the upright height. I'll bring it here. Raise the bed to upright height, and then Miss Mary, I'm back. All right. So after you raise the bed to a comfortable height, we're gonna do immediately is to uh, this hummock, the stock sheet will be about halfway up there. So it's gonna be like that. Okay, halfway. Now this leg is exposed. What you're gonna do is cover it with this towel. And you can do it like that. So she's covered. So what only shows here will be this region here. And now I will test the water. So imagine the process, right? Test water with your wrist. Then Miss Mary, you also test the water. So this is good. I'll put it back here. And this is the time for me to put my gloves on. And then what I'll do next, after putting my gloves on, I'll put on the disposable bed protector. Okay, so you can do two things, whichever makes you happy. You can turn the resident to the side and then apply this, or you can just ask her to lift her buttocks or her hips, and then you can just put it back in there. So have to do your fan fold, and then right, Miss Mary, just raise your buttocks here. Okay, and then you'll just say, it's non-wrinkled, it's properly placed. Yes, they're already. Now, we're all set. What I'm going to do next is I'll go ahead and get my first towel into the water. Then I will wring that, two hands, of course, and then put some soap. Can that be captured there? Make sure that, okay. Bring that, get some soap away from the water, lather away from the water. Then I'll go here. So what you do is 4 inches from the meatus. So your other hand will hold it there at the base. Again, you can see it there. This one, you'll just have to glide it. And then about 4 inches. And then let go. Switch. And then another one. Let go. And then a third one. Hold again at the base. And then, okay, that's with the soap. And then I'll put it back here. And then I'll grab another one. This one is to rinse. The water, bring that, and go back here. Same thing what you did earlier. Hold by the meatus. Then one, switch, two, switch, and then lastly, three. And then this time I'm just gonna have to put it on my side of my basin. Next one, I'll go just to dry it. No water because we're just gonna be using this to dry. Okay, so I'll go from right here. Smear, this is the last one. One, put that in there as well. Two, and last one. Three. Okay, it's about 4 inches. Okay, so at this point, I'll just pull the camera somewhere here. Okay, so what I'm going to do is I'll just gently pull this here from the tip. Just enough to cover her. Just enough to cover her. Okay, then what I'm going to do next is Miss Mary, I'm going to put these items away, okay? So first I will go and take this. Before I go, I'll say, Miss Mary, you have the collates. If you need anything, let me know. I'll just put this away, wash, rinse, and dry, put it in the designated area. Then back, again, still with my gloves on. I'm going to take care of this. I'll just put it that way. And then put it in the soil linen basket. I come back. At this time, I just have to remove this. Okay, Miss Mary, can you please raise your box? Okay, then put that away. Then I'll put that on a trash basket. Then you can just remove this. Hold it here. And then pull that away. And then you can go this way. And then do that completely. Okay. And then you will definitely, every time you remove your gloves, sanitize your hands. Okay, at this time, you can come close to Miss Mary's region again. Okay, Miss Mary, let me just cover here. So that is when I pull this, it's still covered. And then I'll go put that on the soil linen basket. Okay, and at this time, I can sanitize my hands one more time, and then just pull this all the way here. All right, we're done, Miss Mary. And do you need a magazine, TV remote, or a book to read? She said she's okay with the book. Okay, so well then, here is your book. Okay. All right, that's your call light if you need anything, Miss Mary. And then the wheels are locked, the bed is in lowest position. What about the curtains? You met me close or open? She wants it open. I'll open that. Okay, good. So if you want to access your table, you can use this table as well. All right, well then I'm gonna go ahead, wash my hands, and then I'll document.